Alrighty, good afternoon, everyone, and welcome to our monthly All In for Kansas Kids Strengthening Early Childhood in Kansas Systems Building webinar for May 8th, 2024. My name is Julia Gruss. I am a research project coordinator at KU's Center for Public Partnerships and Research, and will be your webinar facilitator for this afternoon. I am also joined by my colleague, Bree Houston, who will be dropping relevant links into the chat today, as well as monitoring the chat for any potential questions that you might have. As always, we'll start off with just going over our webinar cadence for 2024. Always going to be held on the second Wednesday of the month. Our next one will be on June 12th. Sign up to receive our All In for Kansas Kids e-newsletter on the Children's Cabinet website. It's www.kschildrenscabinet.org. There are always important early childhood systems updates being shared there in between these monthly systems building webinars. Our presentations today are by two wonderful members of Childcare Aware of Kansas. We have Jenna Wilborn and Amanda Poyser joining us this afternoon to speak about the Childcare Go team, as well as the Baby Steps program. After they are completed with their presentations, I will hop back on and give you some early childhood systems updates. But without further ado, we're going to kick it over to Jenna, who is going to give us some information on the Childcare Go team.
All right, hello, everyone. I'm Jenna Wilborn. I am the Go Team Manager or Coordinator at Childcare Aware of Kansas. I also do this in conjunction with Amanda. Her and I work very closely together, but I will do most of the talking today on the subject. So we can go on to the next slide. Thank you. Okay, so I just kind of wanted to start by talking about what the Go team is and who's a part of it. It was formed in October of 2022, so not too long ago. And what we do is meet on a monthly basis with both state and community leaders to discuss different emerging community childcare capacity building challenges and barriers. And we talk about progress on those as we discuss them and bring them up in meetings. I keep the team up to date on how those are progressing, how that's being solved and addressed, as well as systematic challenges that are impacting childcare capacity building efforts across the state. So things like zoning issues, changes to licensing and regulations, funding needs, other large-scale issues that if we see them pop up again, we'll know the right procedure and how to address those. And if we have unique ones, we'll work together to address those as well and see what resources we can pull together to help that community out to get them across that barrier. But our main purpose is to quickly and efficiently mobilize local, regional, and state resources to address those community-specific needs to build childcare capacity. We really want to help, speed up the process, help get as many slots open as possible in these communities, and just be a helping hand in helping and assisting them get past those difficult issues, not really sure how to go forward. We want to be able to tag in and help them out. Next slide, please. This is our team as a whole here. We have our state team that is in our monthly meetings typically, which includes KDHE, Kansas Department of Children and Families. We have Childcare Aware of Kansas members as well, Department of Commerce. We have partners at KU, of course, and we also have Kansas State Research and Extension, Kansas State Fire Marshal, Department of Education, a lot of big players, state connections in this realm of childcare, because we want to have as many experts at the table as possible to help address these unique barriers and challenges that arise. So, but we also work in partnership with, local officials when things come up, like city officials, county officials, um, local childcare coalitions. We have our community outreach and engagement team that we work very closely with. A lot of those barriers that come up, they get referred to us by them, and they are our big connection between us and the community so that we can fluidly communicate with each other when addressing these types of barriers. So, yeah, big team, but the more interaction and expertise we can bring to the table, the better. So next slide, please. So this is our process on like when we get a referral, an issue, a barrier pops up. This is kind of our process. So first, the community is notified about our team. Usually they're notified in advance at like community in action workshops, along with if they're already in communication with their community outreach and engagement coordinator from our team, they often refer to our team, hey, like you've got this project you're about to start. If you run into any issues, we've got our childcare go team that can pop in if anything arises that kind of puts the brakes on for a minute. So a lot of times they'll be notified of our team in advance. And then once a barrier is brought to our attention, we meet with those local stakeholders to understand the full scope of the issue. We'll often set up a meeting with that COE coordinator. Me and Amanda will sit in on those meetings and just kind of talk more extensively about what is going on, how our team can really jump in and help, where the pinpoint the true issue behind the barrier. And then we'll just determine if this is a very unique situation, unique issue, or if it's one that could impact the broader childcare community in general. Because sometimes we'll see this isolated incident, but then we have to keep it on our radar because it could be something that pops up in more than one community. So those first, the assess part is really important in really getting to the root of the issue. So then we diagnose and find out which community or childcare go team staff member, team member representative will be most relevant to this issue and identify potential solutions. We always notify the entire team, but some of the issues we know will be specific to specific members as well. But we also want to keep the entire team up to date on these issues, whether it's in their realm or not. So that way everyone's aware of those things going on. And then we set up the connection between our state members and this community. So for example, if it's something to do with fire inspections, then we would connect our Kansas State Fire Marshal representative with them, try to figure out if they need to connect any other individuals to this community to help speed up the process or gain their knowledge and expertise on how to move forward. And then we also try to see if there's any other local or regional effort connection, like through our local systems to that are important to connect with as well in order to make sure the process goes smooth. And then for other isolated barriers that maybe we haven't seen come up before, our staff will also search for and compile existing information and resources to help this community navigate the barrier, and see we can work together to, even if it's new, we can still work in partnership with them to try to find as many resources as possible to help navigate that. If new resources are needed, which sometimes they are, especially if it's new, we also work with external partners, starting with the most local and then expanding the scope if need be to find or create a new resource. And I'll talk a little bit about how we've done that recently in a couple slides. So that's something we have done and are doing as well. Thank you. Okay, so I wanted to talk about some of our successes that we've had. Recently, we have worked with many communities across the state to address these types of capacity building barriers. Especially recently, trying to navigate a lot of different topics, barriers, even the newer ones. It's been very interesting gathering those new resources and learning from those, so that we can help communities that come across similar barriers in the future. We've also specifically, we've helped with childcare facility building plans. So communities that have plans, projects in the works, and they just need help getting through a couple of the different steps along the way, supporting communities when closures happen, and when communities really need to switch gears to meet requirements. So sometimes, there's a plan in place, something comes up, and it's the only option is to really switch the mindset, switch gears, change your plan. And we've been there to help with that transition as well. So we've seen a couple different scenarios, excuse me. One that I really wanted to talk about and highlight is a community had reached out to us about some necessary building sketch requirements for the fire marshal. They needed like a code footprint for their building. And there were some misunderstandings about the necessary requirements for that, and there was some going back and forth. So we were tagged into that, and I reached out to our KSFM representative, and they got a fire chief connected with that individual within 24 hours and helped solve the issue so that they can move forward with their plans. So really quick turnaround. It's not always that quick. We always hope it is, but just a success that we've had within the last year that was really great. And then we followed up with that individual afterwards to see if there's anything else that they needed from us. And of course, we always say, if there is anything, don't hesitate to reach out. But it's awesome to see how quick this team can pull together resources and work together to create a quick turnaround as fast as we can. So next slide, please. Thank you. The next part of the presentation, I want to spotlight our community support webpage, which we are so excited about. We just launched this on our website, Child Care Aware of Kansas website, early this year. And we had worked for months to gather resources of all kinds to create a center support page where communities can find all different types of resources needed for all different types of areas. So I'll just kind of walk through what we have on there now and also our plans for that in the future, because of course it will continue to evolve as we go. So the first part here, you can see this is how you find our page. You just go across the top there, the communities tab will drop down and it's right there, Community Support Center. You'll click on that, that'll bring us to the main page. Yeah, Brianna just dropped the link in the chat. If you guys want to check that out for yourselves and navigate and explore that on your own time. But yeah, so that's how you find it on our website. Next slide, please. Okay, so when you scroll down, you're going to see these couple tabs here, the resources tabs. The first tab, it talks about family-friendly workplace and just some resources that our team has had on hand for businesses that are looking to create that family-friendly workplace in their establishments. We also had linked Child Start, Kansas Power the Positive, First 1,000 Days of Kansas down below to, because they also have additional resources, our partners. So Kansas Power the Positive also has a survey, a business survey that they can distribute, that employers can distribute to employees to see what kind of needs need to be met to make sure that they're meeting that family-friendly workplace model. The second tab there is child care support contacts. So we compiled a tab full of contacts that are at the local, state, and national level. Each contact on there, they're all relevant to childcare in some way, shape, or form. And each one has a short description of who they are, how it's relevant, you know, so that they don't have to, the person going through the support contacts don't have to do that themselves. It kind of just gives them a preview, like, is this relevant to what I need? Are these the right people to reach out to, yes or no? But there's plenty of contacts on there. National resources include like the ACF cost of care calculator, collective impact forum, blogs that are related to that. But a lot of our statewide resources include us, Child Care of Kansas, and a lot of the partners that I mentioned earlier that are on our state Go team, as well as other opportunities as well that are relevant. The third tab there is zoning. So earlier last year, we created a zoning frequently asked question document. We kind of pulled a lot of questions off of recent surveys and try to just compile a commonly asked question sheet. And we did this in collaboration with KDHE and State Fire Marshal, just to kind of get, you know, their expertise and correct, you know, appropriate language, wording, things like that, and making sure that we're addressing those things with them as well, so that the answers to those questions are as accurate as possible, as well as tagging in additional contact information if an individual would have more questions to ask after reading through that document. And then the last tab is helpful articles. So these were collected and added over time. We're still adding to that as we find them, of course. But some of the things that we've tagged on there are Raising YCO, Childcare Tax Credit Toolkit. One of the things I mentioned earlier, where sometimes we create resources in unique situations. One thing that we did create was a insurance list. So we did some research on some insurance companies that would cover centers, in-home providers with things like liability insurance, and trying to do the research on their behalf So it's just one less thing that the provider needs to do. So we just compiled a list of different insurance companies that offer those types of policies. And it'll tell them like what their coverage like requirements are, things like that. And again, it's just we're trying to cut down the work for our providers because they already do so much, so we want to help them as much as we can. We also have Kansas Child articles, our magazine, quarterly magazine that comes out. Any articles that would be helpful, relevant to this support page, we've also tagged in as well. Earlier we had we had an article written up as well called A Guide to Addressing Childcare Needs. And it was kind of a step-by-step article that talks about how, like if you're a community that's wanting to come together to make change happen, like there's a local zoning code that may be a barrier for you. It talks through the process of the steps needed to take in order to make that change happen, how you can partner with local, regional representatives, connect with your coalition, local childcare coalition if there is one, or start one. So that's an interesting read if a community ever comes across something like that. So that's our step-by-step process as well. Let's see, next slide, please. Thank you. Another thing we worked on as well is sharing community stories. So we also did interviews with the city of Wichita and Saline County because they had some recent successes in addressing some childcare barriers in their communities. And like for example, sorry, trying to navigate a couple things here. So Wichita was tackling a zoning code restricting the potential for increased childcare capacity. And then Saline County was dealing with something similar that was making it difficult for in-home and group providers to open. It was just kind of making the process a little bit more difficult. So we spoke to a couple people that were involved in those situations and addressing those barriers. Like, for example, we spoke to a Wichita City Council member that was involved in that story, and then the Early Childcare Initiative Director at Salina Area United Way to learn more about what happened, what they did to work together, and collect some quotes from them to include in the article. And what we really want is to give communities a platform to share these stories so others can be inspired. Maybe they're going through something similar and they're like, well, maybe we go about doing it this way. But we want to share those successes because they are a big deal. When childcare, it's such an epidemic right now, wanting to get as many slots open as possible, that working in your community and partnering with the right people and getting as many people on board as possible to make that difference it's really impactful and important to share those stories. So and we want to continue to share those stories in the future. This is just the beginning, but it's a great read if you get a chance to. Next slide, please. Another additional page on this community support center is the community-led coalition page. So there's a link to it as well on that community drop-down menu, and it's linked on the page as well. But when you click on that, it's going to bring up this map of the state. And what we did was reach out to all the existing community-led childcare coalitions to ask permission to share their contact information on this webpage. And why we did this is we want coalitions to be able to connect with each other more easily. If they want, some advice, they want to, partner, work together on something. But we also want their community members to be able to connect with their coalition as well. Like if somebody's interested in joining one, we want their contact information to be available, not difficult to find. So after reaching out to all the ones that we had in our system, we had 44 counties currently on the webpage. So you can see all the ones in blue are the ones that have given us permission to share their coalition information. Now, that's 44 counties, but that number of actual coalitions may be a little higher because some of those counties have multiple coalitions within the county. Like if it's a larger county, sometimes different cities will have their own childcare coalition. So it's really exciting to see the response and people wanting to share that with us, which is great. If you know of a coalition that would be interested in being a part of this, it's really simple to get added to this map. There's just a information release form that we send to the coalition lead. And it's like a one-pager PDF. You just fill out name, number, email, just whatever you want us to share on that page, and just sign it, send it back to either me, or we have a marketing email as well that's on the bottom of the form. Yep. Thank you, Brianna, our marketing too. So they can get that coalition added, county added to the webpage. So this is just phase one. When you click on the county right now, it just brings up a little box that has the contact name, contact email or phone number, things like that. But as this page evolves, phase two for this would be not only having contact information, but eventually we'd like to include and showcase coalition initiatives, their goals, successes that they've had. And again, just another way to platform those things that the coalition is working on. Like, hey, this is a project we're working towards. If you want to get involved, and here's some things that we've been successful with in the past, and all this different stuff. So we'd like for it to build to something like on that level, but we've started with this contact information first, just to get us started. So yeah, very exciting. I hope to continue to see the page become more and more blue over time, but we've certainly had a good response to begin with. So all right, next slide. Thank you. Okay, well, that is what I have for you guys today. The link was shared already in the chat. So, but if you ever need to reach out to us at Childcare Aware, there's some information there for you on the right-hand side. And yeah, it's been great talking about the Go team today. I think we have been doing some really great work, and we are looking forward to continue to help support communities in the state in the future. Thank you.
Thank you so much, Jenna. And we're going to pass it right off to Amanda, who is going to talk about Childcare Aware's Baby Steps program.
Thank you, Julia. I also wanted to plug for Jenna, if you feel like in your community you need the Go team, the contact information to connect with Jenna is on that webpage as well. She has a direct email with the Go team in there, so that is there as well. But I'm Amanda Poyser. I am a interim senior program manager for Childcare Aware of Kansas, and I help out with a multitude of projects that we have going on, one of them being Baby Steps. And the ultimate goal of Baby Steps is to help increase the access to infant care throughout the state. We know that it is an issue statewide, as well as childcare is an issue statewide. And you can go to the next slide. So Baby Steps is a pilot program that is entering year 2 in June. We are very close to that mark. And we have developed an innovative solution to help increase the access to infant care throughout the state. We often overshadow infant care with just the larger issue of childcare in general. And we understand that infant care for family childcare providers ultimately affects their bottom dollar and how much they are making. And a lot of times is not a smart business decision for them to provide that infant care because it reduces the amount of slots that they can have in their family childcare program. And again, decreases their net income. So the goal of baby steps is to increase the number of slots, maximize revenue and minimize costs for providers, and increase their net income. You can go to the next slide. We also understand that family childcare programs cannot afford to provide care to infants. They can't afford to take less income-wise, and families also can't afford to pay more for childcare. So we looked at shifting how family childcare providers fill these spots and came up with this innovative solution by offsetting their revenue lost from filling those infant slots, in turn increasing their net income. You can go to the next slide. We have this wonderful thing at Child Care Aware of Kansas. This is our budget tool. It is available on our website for providers to use. And we understand that the greatest revenue potential for a family childcare provider is one that has no infants. And you can kind of see that breakdown on there, that without us incentivizing that, a family childcare provider was making about $11.46 an hour. And that's on average. It varies throughout the state, but this is an average we took. And then increasing from 1 to 3 infants, we saw a decrease at 3 infants, as you see on there, to $6.71 an hour. Again, impacting their net income. So we said, how do we fix this? How do we incentivize this? And we looked at increasing that to make a livable wage of $15 an hour or around there. So depending on the amount of infants that they care for, we increase their wage, taking that closer to $15 an hour. You can go to the next slide. We did this by conducting a few surveys and running them through family childcare providers. And in those surveys, all providers reported that they would accept 2 to 3 infants if loss of income were not a factor. And providers that accept infants were evenly split when asked whether they'd be willing to accept additional infants if loss of income were not a factor. And providers that currently do not accept infants were less likely to indicate that loss of income was a factor. They indicated that it could be like personal preference or something else that they just chose not to care for infants. You can go to the next slide. So we took this program and we said, where do we start? We know that infant care across the state as a whole is an issue. So we looked at counties that had a high social vulnerability index, a high birth rate, a low desired capacity meets potential demand, and a high number of children under 3 per slot. And then we added in some additional levels and we said, okay, let's make sure that this provider is in good licensing standards with KDHE, as well as passing a pre-screening through our team to make sure that it is a good fit, because we know that infants are a very vulnerable population. We want to make sure that they're going into a good fit with a provider and the family themselves. So we started with 10 Kansas counties and we've expanded, as you see on here, to all of the counties that are in blue. And once that provider agrees to accept 1 additional infant from what they are currently caring for, they have to agree to engage with our partners at the Infant Toddler Specialist Network and agree to complete quarterly touch bases with our Baby Steps coaches. They will receive a stipend to help offset that loss of income that they're facing when enrolling that infant. And all of those counties that I said, like I said, on there that are in blue are counties that we are currently recruiting or have providers recruited in. You can go to the next slide. This This right here is a compilation of year 1 and year 2. We have started recruiting providers for year 2 and are still actively recruiting providers in Wyandotte, Atchison, and Johnson counties. But right now we have recruited 73 providers, which is 10 more than last year when we closed out the program, and have impacted 94 infant spots throughout the state. So we are seeing this program work. And it is being very successful throughout the state as a model to help increase that access. You can go to the next slide. And here we kind of talk about it. Like I said, we've increased 94 infant slots and now available in 18 Kansas counties. In those original Kansas counties that we started with, 66% of the counties that participated saw an increase in access to infant care, and 7% more infant slots were being filled. Providers have access to additional resources throughout the state, like ITSN, and they have an increased income from this program. We've also learned some things throughout the last year. We originally started, like I said, with 10 Kansas counties, and we ran into barriers as far as providers just didn't have the space. And we know that. We didn't realize how large of a scale it was going to be on. So we did have to expand out into additional counties, and we recruited more providers that way. It also, the school year played an impact into that. And providers had to age out children that were going into kindergarten to take on children that are younger. It also, through the last year, we've learned that license type did play a factor into this as well. We saw that group providers were more willing to accept infants into their home because they had an extra set of hands there. And that led us to figuring in that additional cost for another adult being there, because 2 salaries coming out of that business's income. So we were supplementing for both providers being in the home. You can go to the next slide. And these are just some provider testimonials I'll let you read over. But just to summarize, providers have reported they are more willing to enroll additional infants with financial supports and coaching supports that have been provided throughout this program. And they have enjoyed working with our partners at ITSN to further their knowledge and develop skills in the early childhood field. And questions, if there is any. Okay.
Thank you so very much to Amanda and for Jenna for taking time out of their day today to give us that very important, relevant information for all of those working in childcare in Kansas. These slides always go up on the cabinet website. So if you didn't have the opportunity to read those wonderful testimonials on the last slide, you can always access the full slide deck on the Children's Cabinet website, typically within 24 hours of our webinars. So I am going to move right along into our early childhood systems updates. Starting off with Greenbush holding a monthly virtual early childhood forum. Greenbush serves learners of all ages by working with schools, communities, and agencies statewide to ensure equal educational opportunities for all. This early childhood forum is a space where early childhood providers and educators can collaborate in group discussions, share experiences and resources, ask questions, and discuss trending topics related to early childhood. Early childhood providers can discuss and share assessment and data collection processes to provide effective intervention strategies in working with young children. You can sign up for the monthly virtual forum and other events and professional development opportunities through the Greenbush website. And all of those links that you see on the slides will be placed in the chat by Brianna as we go through. Next up, the Stellar Insights Early Childhood Data Webinar Series began in March with their Every Child Counts, an Introduction to Data Resources webinar. They are now asking all early childhood service providers and parents to fill out their early childhood community survey. Responses are welcome from people working in early childhood services, parents of children, or anyone else who is interested in Kansas early childhood services. So this survey is designed to collect information about the people involved with early childhood services in Kansas, the data that they interact with, challenges that they encounter, and areas where future collaborations could be useful. You have until May 14th to fill out this survey to help understand where we can work together using early childhood data to better serve the children and families of Kansas. And if you have any questions, you can also contact the ECIDS team at ECIDS, ECIDS at ku.edu. This survey will only take about 5 to 10 minutes to complete and does not require the submission of any personal data. Responses collected will be used to inform their future work, including the Stellar Insights event series, which is focused on building collaborations around early childhood data to better serve the children and families of Kansas. Their next Stellar Insights webinar is on referral services as data connections, and that is going to be held next month, but the details on date and time of that webinar should be in next Monday's edition of the All In for Kansas Kids e-newsletter. Next up, we have our Title V Needs Assessment. Help shape the future of health services for Kansas families. Researchers at KU's Center for Public Partnerships and Research with the Maternal and Child Health Program at the Kansas Department of Health and Environment want to learn more about the beliefs held around the systems of care for women, infants, children, and adolescents. Community engagement sessions are being held across the state to give Kansans the opportunity to share their experiences with health services for women and children and their ideas for improving programs for maternal and child health in their communities. The community engagement session tour kicked off this morning in Garden City at the Finney County Public Library, and those sessions will continue through the end of June. You can join us at next month's webinar on June 12th to hear from the lead researchers of the Title V Needs Assessment and to share your opinions on these health services in Kansas. So as you can see, the full list of events is there on the right-hand side of your screen. So take a look and see if one is happening in your area. They are happening within local libraries and are a free, just come and go event. So if you are only free to come for 15 minutes, that still helps with their work on this needs assessment. Early childhood conferences, we are focusing on the Child Care Aware of America 2024 Symposium, Raising Childcare, Raising America. This is happening from May 19th through the 22nd at the Crystal Gateway Marriott in Arlington, Virginia. At this 2024 symposium, they will confront the question, how do we capitalize on our wins and lessons learned and boldly tackle our field's hardest challenges? Child Care Aware of America invites child care resource and referral staff, state administrators, and systems level leaders to attend this 2024 symposium to grapple with this question. If you register today, you will receive $125 off of your registration fee. That was a deal that they had for the last 3 days, and today is the last day to get that $125 off. You can learn more and you can register at the link that Brianna has placed in the chat for us. And next, our Child Care Provider Appreciation Day. This Friday, May 10th, is recognized by Child Care Aware of America and by the state of Kansas as Child Care Provider Appreciation Day. Governor Laura Kelly recently proclaimed Friday, May 10th as Child Care Provider Appreciation Day in Kansas. The Kansas Department of Health and Environment, along with Child Care Aware of America, celebrates this special day on the Friday before Mother's Day every year to recognize child care providers, teachers, and other educators of young children. You can look for Provider Appreciation Day events in your area on the Child Care Aware of Kansas website. And on the Child Care Aware of Kansas website, they also have some words of gratitude that were shared by those that work at Child Care Aware of Kansas, as well as those that work with Child Care Aware's state partners. And I wanted to just share some of those words of gratitude with everyone now. So thank you to all of our hardworking Kansas childcare providers. We couldn't have made it through this year without you. Thank you to the incredible, dedicated people who care for and teach our youngest children. You are the change makers at work daily on behalf of our families and communities. You are essential and appreciated. The relationship between childcare providers and their communities deserves a celebration. Words cannot truly express the impact that your dedication, care, and commitment has on children and families as we reflect on the past, live in the present, and look forward to the future. Your efforts do not go unnoticed. The work of a childcare provider is truly a calling, and we appreciate you. We want to thank all childcare providers in Kansas for their dedication in working with children and families during the pandemic. Your commitment and compassion to providing valuable services and care to families is greatly appreciated and recognized. Your efforts are helping to make Kansas a great place to live, work, and raise a family. Thank you for all that you do to nurture Kansas children. You play a critical role in helping us reach Kansas's vision of leading the world in the success of each student. You are the true heroes, and we cannot thank you enough for being there for children and families in our state. And we are with you and thank you for all that you do every day. You are the foundation for our communities. So once again, thank you so much to all of our amazing childcare providers in the state, and as well as a very happy Mother's Day this weekend. For reminders and next steps, we have our early childhood recommendations panel being held next Friday on May 17th from 9 to 11:30 a.m. This meeting is live streamed on the Children's Cabinet YouTube channel, and the recording remains there afterwards. The next Children's Cabinet meeting will be held on Friday, June 7th from 9 a.m. to 12 p.m. And our next Early Childhood Systems Building webinar, where we will have the lead researchers of that Title V needs assessment here to speak about that and to get your opinions on the maternal child health services in the state, will be held on Wednesday, June 12th from 12 to 1, always that second Wednesday of the month. And again, you can find all of these meetings and more on the Children's Cabinet YouTube channel. You can stay up to date with us by signing up for that All In for Kansas Kids e-newsletter, so you can receive all these updates on a weekly basis. You can follow us on Twitter or X, and you can also subscribe to the Kansas Children's Cabinet YouTube. So thank you so much for everyone who joined us today. Thank you again to Amanda and Jenna for their presentations, and we look forward to seeing you next month. Have a great rest of your week.